Let's turn our attention to the Eastern Cape province now. The health department there is planning to vaccinate 3.7 million people within the next 6 to 9 months. Each vaccinator will be required to vaccinate at least 50 people per day. That's to meet the set target. Now, the province is said that it would take a leaf from the IEC's book and use schools, churches and community centres as vaccination sites. All right, let's continue the conversation, and we're joined by the advisor to the Premier of the Eastern Cape, Dr Thobile Mbengashe, who talks to us from East London this morning. Dr Mbengashe, thank you very much for your time. These vaccination sites, let's start there. How many do you plan to have spread out throughout the province of the Eastern Cape?
Thanks, Xoli. Thanks for taking us. The government itself has got about 1,000 facilities, meaning that we've got clinics and we've got hospitals that are really going to be our primary sites. And when you look in terms of the plan, phase implementation of the vaccine, the healthcare workers are going to be the first one, meaning that where in private and public, these are the individuals who are already existing in our system. We'll prioritize them, get their first full dose and get their second dose. That will release a lot of resources that's going to be available for the essential workers within the second phase. That will be allowing us to use the public plus the private business facilities. But what's going to be very important for us is really the outreach program that's really going to be targeting all the districts, making community halls, what we call supervised vaccination facilities, to make sure that we're reaching as many people as possible.
Yeah. Perhaps, Dr. Mbengashe, what I should have started with is what date has been given to you by health authorities, I suppose, at national level, as the date that these vaccines will reach your province?
Yeah, so the most important thing is that the minister has been on record to say that we'll get our first sort of vaccine of the 1.2 million from COVAX facilities that are going to be in the country. We expect those somewhere, we're planning around February to really get those. But what is important, we want to put a lot of all the pre-work so that when those vaccines are coming up, we're already there. The Premier set up this committee, which I lead, and we've been speaking already to all the different partners to make sure that they are ready. So the uncertainty is the arrival of the vaccine, but we think it's going to be there in February, but we're actually making sure as the vaccine lands, we're ready to do the vaccination.
All right, so it's fair to say that there isn't a definitive date right now, except to say somewhere around February, yes?
Yes, we're aiming for February because I think we are very dependent on the vaccine landing in the country, the national department distributing it to the province, getting to our depot system and going directly to our hospitals, and then actually distributing within those hospitals in terms of the designated groups.
All right. Now, your province, Dr. Mbengashe, vastly rural, and I can just see those elderly people with their sticks walking very long routes to try and get to the vaccination center. How long will how far from people's residences will these vaccination centers be? I am reading from your statement there that these vaccination centers should be no further than 5 kilometers on average for the person to travel.
This is correct, Xoli, because what we have, and I think this is very important, there's a lot of experience of doing what we used to call campaigns to vaccinate young people and children. We've also done what is called the HPV vaccine, which we have actually used schools. Schools are the most available community assets. And we're really going to take up the lead from the IEC, making sure that we are really taking up this outreach, getting closer to where people live, and making sure that nobody travels more than 5 kilometers. We're very conscious about the queues. We're very conscious about the experience we had in the SAPOs and in the DST program. So we don't want people to be exposed further because of the vaccine. Yeah. But what is important about the vaccine is that the vaccine is a much more simpler program. As long as you keep the sterile environment, you keep the cold chain, you make sure that you've got sufficient vaccinators at a time, and the facilities flow is actually managed very well.
Yeah, let's talk about the vaccinators, Dr. Mbengashe. How many are they, and have they been employed already? Because we are at the end of January now. If you are going to do, or if you're going to receive your first consignment, the assumption is that at least you have employed some of them.
Yes, this is actually very important because if you recall, our first group is the healthcare workers. And those groups actually reside in hospitals. Most of them are actually nurses, and they're putting injections on people's bums every day. So the vaccination in terms of the first phase is really reasonably well designed because it's going to happen where healthcare workers are. So these nurses and other people are going to be ready for that. It is really the second and the third phase where we're going to have vaccinators that leaves the hospitals. And what we have really been building on is that we employed a lot of people for the COVID. We are now in the downturn on the COVID. So we're going to be releasing a lot of those people, and we're going to be moving some of those people in terms of the vaccination program. And we're also going to be working with some of the people that are actually going to support us and getting whatever additional resources we require. So the healthcare worker group, in terms of the readiness to vaccinate, all those resources exist in both private and public in terms of our hospitals.
Yeah, okay. Talk to us about probably the most contentious part of this vaccination plan, and that is the service provider who is going to be in charge of distribution. Have they been appointed? How has the process, or what process has been followed to try and appoint them if they have been appointed already?
The approach of the province, we've really been, what we did, we created what is called work streams. There's a work streams for logistics and distribution. There's a work stream that's going to be looking in terms of the inventory and management within the depots. Our idea is that, and we're using the system that we've known that work very well. The depots are going to be our primary recipient of the vaccines. The big hospitals, about 85 of those hospitals, will be able to receive many of the vaccines because they've got the cold chain and other facilities. And these will be our primary distribution. Most of our clinics actually do get vaccines on a daily basis. And the fact that we're going to get a vaccine that is much more stable, that is heat stable, that is easier to keep in a cold chain is going to make a huge difference between the transportation from the primary distribution site to the secondary sites where vaccine is going to be delivered. The big challenge we're going to be working through in terms of the logistic is when we're doing what is called an outreach. Again, we know how to deal with this outreach is that we have a cooler boxes, we've got people, we prepare the numbers, and we make sure that by the time we get there, we are actually allowing us that 6 hours for really the stability of the vaccine.
And that's the most probably contentious element, Dr. Mbengashe, the logistical nightmare that is going to come with this distribution. I hear you when you say you're going to be working in work streams. The depots are going to be the receivers. I just want to make this clear. I want to get this point out very clear. There is no independent distributor of this vaccine who would have been appointed via a tendering system. We're not going to hear stories like that.
At the moment, Xoli, we have got what is called a DSVs. These are interlinking distributors that are already on sites, that are already doing this. We're not going for a new tender for this process. We think that what is going to be very important is that we are going to be working with what we call a devolved system. For instance, if we're going to vaccinate people at Checkers or Woolworths, we're going to be working with the Woolworth management so that the people of our arranging, the people for the queues, making sure that we got the right NPI arrangements, social distances, are going to be the localized people. In the rural communities, we're going to be working very strongly with the leadership and everybody else, because these community assets are available from the leadership. We're going to stay within our system. We've learned quite a lot in terms of the problems of corruption into the system, but luckily the system of vaccination, we are very well versed about how to get vaccine, how to get campaigns, how to vaccinate young girls in schools, and how to vaccinate children from unreached areas. So you're right, the roads are going to be very important. The cold chain is going to be very important. The number of vaccinators is going to be very important. Good data at where the vaccine is going to happen is going to be absolutely very important. And the really community being involved and really making sure that no one stands in the sun to get the vaccine. And we arrange that very well.
Okay, and the population you plan to target, Dr. Mbengashe, for the Eastern Cape province to reach herd immunity?
At the moment, we have, in terms of the healthcare workers, we have about 125,000 as a general plans for all the healthcare workers in the province. And then the second group, we're planning to vaccinate about 1.7 million of those people. And the last biggest group is about 2.5 million, which is the phase 3 groups. And these are people. And then in terms of vaccine, each one should get 2 doses. So the numbers are going to be doubled onto that. So on average, we're really looking for about 8 million doses to cover the 3.7 million people, and to make sure that at least we're able to cover for those, unexpected matters in terms of, bit of usually put about 10%, where you know that there could be variation in the number. Some people will come in, some people from other side. So that's really the plan. And that plan, I think the key issues about whether it's feasible is the fact that it's not going to be done in one go. So you do the first group, you finish it, you go to the second group, and you could have a bit of an overlap, and then you're able then to spread your resources and the vaccines and the commodities. And we're going to learn from what has happened from the first group, especially the healthcare workers.
Yeah. Talking about the health care workers, Dr. Mbengashe, finally, make us understand, once the vaccines get to South Africa and they reach your province, are you aiming to vaccinate both health workers in the private and public sector?
This is quite correct. There's a little bit of a discussion onto this, but in terms of the national supply for vaccine, in terms of our planning on the total number of healthcare workers, we are planning for both private and public. There are some discussions around the financing, but that's not going to be the primary concerns. What it actually means, those who are in medical aid, they might have to recoup those costs. But in terms of the buyer, payer, and the distributors, we're going to cover everyone. And we're really speaking both to the private colleagues, we're speaking to people of hospital services, so that all of us are really on one purpose to actually make sure that our healthcare workers get their first and second doses in the first round of the vaccination.
All right, Dr. Thobile Mbengashe, he is the special advisor to the Premier of the Eastern Cape province, talking to us about the rollout plan once the vaccines reach the Eastern Cape's shores. I can tell you that following from this conversation, we're going to be speaking to Stavros Nicolaou. He is with Business for South Africa, also a very, very important player in the acquisition and distribution plans. In a moment, we're going to have a conversation with him. This is Newsfeed, the AM edition.